Stomach viruses, what you need to know. Quick summary. Stomach viruses are common but have no cure. Your immune system handles the infection. Supportive care is the only treatment. The top priority is to aggressively prevent dehydration with oral rehydration solutions, ORS. Cooked, bland foods are easier to digest during recovery, and raw foods should be avoided. Seek medical attention if symptoms are severe, prolonged, or include signs of severe dehydration. You remain contagious for days after symptoms pass, so continue practicing strict hygiene. Key terms to understand. Oral rehydration solution, ORS, a drink with a precise mix of salts and sugars that helps your body absorb water more effectively than plain water or sugary drinks. Supportive care, helping your body recover by treating the symptoms, like staying hydrated and resting, rather than directly attacking the virus itself. Self-limiting. A self-limiting illness means it will go away on its own in healthy people, even without medication. Contagious/infectious. A virus remains infectious and can be transmitted to others even after your own symptoms have disappeared. This is why good hygiene is important even after recovery. Probiotic, beneficial bacteria that help restore a healthy balance in your gut. They're found in some supplements and foods like yogurt. Red flag symptoms, like bloody diarrhea, high fever, or sharp, localized pain, suggest a more serious problem than a simple virus and warrant immediate medical attention. Navigating abdominal discomfort can be confusing, as its causes range from simple indigestion to more serious illnesses. This article provides a clear, comprehensive discussion on one of the most common culprits, the stomach virus, also known as viral gastroenteritis. We will clarify the difference between a general stomach ache and a viral infection, discuss the science behind your body's natural response, and provide actionable advice on supportive care and recovery. Stomach ache versus abdominal pain, what's the difference? While often used interchangeably in everyday conversation, stomach ache and abdominal pain have distinct meanings in a medical context. Understanding this distinction can help you better describe your symptoms. Abdominal pain. This is a broad term for any discomfort or pain felt anywhere in the abdominal region, which extends from below your chest to your groin. This vast area contains numerous vital organs, including the stomach, intestines, liver, gallbladder, pancreas, kidneys, and parts of the urinary and reproductive systems. Consequently, abdominal pain can stem from a wide array of issues, from minor to very serious, making its location, character, and accompanying symptoms crucial for diagnosis. Stomach ache. This term specifically refers to pain or discomfort that originates from the stomach itself. This is typically a cramping, burning, or dull ache felt in the upper abdomen, often slightly to the left. A stomach ache can be caused by a variety of common, non-life-threatening issues, including digestive problems, indigestion, gas pain, constipation, or food intolerances, like lactose intolerance. Inflammation, conditions like gastritis, inflammation of the stomach lining. Irritants, overeating, consuming fatty or spicy foods, or excessive alcohol. Stress, psychological stress and anxiety can often manifest as stomach discomfort. For these reasons, a stomach ache is often a transient and manageable issue. However, when the cause is a stomach virus, the symptoms become more specific and often include vomiting and diarrhea, which points to a distinct set of challenges and care needs. What are stomach viruses, viral gastroenteritis, and their symptoms? Stomach viruses is a common term for viral gastroenteritis, an intestinal infection that causes inflammation of the stomach and intestines. Despite its common nickname, stomach flu, it is not related to influenza, the flu that affects the respiratory system. Several viruses can cause gastroenteritis, with the most common culprits including norovirus, the leading cause of viral gastroenteritis in adults, highly contagious, with symptoms usually appearing 12 to 48 hours after exposure and lasting 1 to 3 days. It's important to note that you can remain contagious and shed the virus for several days after your symptoms have resolved. Rotavirus, the most common cause in children worldwide, particularly severe in infants and young children, with symptoms lasting 3 to 8 days. A vaccine is available for rotavirus. A brief note for parents: the rotavirus vaccine can protect infants from this severe form of gastroenteritis. Consult with your pediatrician about the vaccination schedule. Adenovirus can cause a variety of illnesses, including gastroenteritis, with symptoms typically lasting 1 to 2 weeks. Astrovirus, more common in children, with symptoms usually lasting 1 to 4 days. Common symptoms of viral gastroenteritis. Symptoms often come on suddenly and can vary in severity. They primarily affect the digestive system but can also have systemic effects. Nausea. Vomiting, often sudden and forceful. Watery diarrhea, usually non-bloody. Bloody diarrhea points to other, often bacterial, causes. Abdominal cramps or pain. Low-grade fever, though not always present. Headache. Muscle aches or body aches. Fatigue or general malaise. Loss of appetite. Onset and duration. Symptoms typically appear within 1 to 3 days after exposure to the virus and usually last just a day or two for norovirus, though some can persist for a week or even up to 2 weeks, e.g., adenovirus. No antiviral cure. Importantly, there are no specific antiviral medications to kill these viruses once you are infected. Treatment focuses entirely on supportive care to manage symptoms and prevent complications. Stomach virus versus food poisoning, what's the difference? When you have symptoms like vomiting and diarrhea, it can be hard to tell if you have a stomach virus or food poisoning. While the symptoms can feel similar, they have different causes and patterns. Knowing the difference can help you figure out what happened and what to do next. Stomach virus, viral gastroenteritis. Food poisoning, bacterial. Cause. A contagious virus, like norovirus, that you can get from food, water, surfaces, or other people. Harmful bacteria or toxins in food that you ate. Onset. Slower. Symptoms often appear 12 to 48 hours after exposure. Faster. Symptoms can appear within a few hours after eating the contaminated food. Spread. Highly contagious. You can easily spread it to others through close contact, respiratory droplets, e.g., from vomiting, or contaminated surfaces. Primarily acquired from contaminated food/water. The illness results from ingesting the contaminated item. While bacteria can be shed in stool and spread person to person through poor hygiene, the initial outbreak typically stems from a common food source, rather than direct human-to-human transmission being the primary route of acquisition. Duration. Symptoms usually last from 1 to 3 days. Symptoms are typically intense but very short-lived, often resolving in 24 hours or less. Important clarification on contagion. While the table highlights that bacterial food poisoning often originates from a common contaminated food source, it's crucial to understand that many bacteria that cause stomach issues are contagious and can spread from person to person. Bacteria such as Salmonella, E. coli, Shigella, and Clostridioides difficile, C. diff, are frequently transmitted via the fecal-oral route, e.g., through poor hand hygiene after using the restroom. The distinction in the table refers to the typical initial source of infection in an outbreak, a common food source for many food poisoning cases versus highly efficient person-to-person spread for viral gastroenteritis. Therefore, strict hygiene practices are essential to prevent the spread of both viral and bacterial gastrointestinal infections. The immune system's role: why most stomach viruses are self-limiting. The reason most viral gastroenteritis cases are short-lived in healthy individuals is due to the efficiency of the body's immune system. A self-limiting illness means it will go away on its own, even without medications. Innate immune response: upon viral entry, specialized cells quickly detect the invaders and release signaling proteins like interferons, proteins that alert and protect neighboring cells. This initiates inflammation, which helps recruit more immune cells to the site of infection. Adaptive immune response: white blood cells, T cells and B cells, are activated. Cytotoxic T cells directly destroy infected body cells, while B cells produce antibodies that neutralize the virus and tag infected cells for destruction. The formation of memory cells ensures a faster, stronger response if the same virus is encountered again. This coordinated and rapid immune response effectively clears the virus, leading to symptom resolution. When to seek medical attention: addressing complications, not the virus itself. Given that there are no direct antiviral medications for common stomach viruses, medical attention for viral gastroenteritis primarily focuses on managing complications, particularly dehydration, and ruling out other, potentially more serious conditions. If you or someone else is experiencing severe symptoms, especially signs of dehydration, it's crucial to seek professional medical care. What medical attention can do includes: addressing severe dehydration, intravenous, fluids. This is the most common and critical intervention when oral rehydration, drinking fluids, is insufficient. If persistent vomiting or very severe diarrhea prevents adequate fluid intake, individuals can quickly become severely dehydrated. Signs of severe dehydration include extreme thirst, dry mouth, reduced or no urination, dizziness, lightheadedness, lethargy, confusion, sunken eyes, or rapid heartbeat. In these cases, healthcare providers administer fluids and electrolytes directly into a vein. This rapidly rehydrates the body, restores electrolyte balance, essential minerals like sodium, potassium, and chloride, and can be life-saving, particularly for vulnerable populations like infants, young children, older adults, and those with compromised immune systems. Prescription anti-nausea medications, antiemetics. If vomiting is severe and continuous, making it impossible to keep down fluids or medications, a doctor might prescribe stronger anti-nausea medications, e.g., ondansetron. These can help break the cycle of vomiting and allow for oral fluid intake to resume. Ruling out other conditions. If symptoms are severe, prolonged, or unusual, e.g., high fever, bloody stools, very localized severe abdominal pain, a doctor will conduct tests to ensure the illness is indeed viral gastroenteritis and not a bacterial infection, parasitic infection, or another acute abdominal issue, like appendicitis or bowel obstruction, that would require different, specific treatments. Lab tests may include stool culture, a test that identifies bacterial pathogens. Stool PCR panels, a highly sensitive molecular test that quickly detects genetic material from multiple pathogens. Parasite examination, ONP, a microscopic examination of stool for parasites. Blood tests may check for signs of severe infection, electrolyte imbalances, or kidney function. Hospitalization. In very severe cases of dehydration, unmanageable electrolyte imbalances, or concerns about underlying serious conditions, hospitalization may be necessary for continuous monitoring and more intensive supportive care. Ultimately, medical attention for viral gastroenteritis aims to support the body's natural healing process and prevent dangerous complications, with severe dehydration being the primary threat. How doctors diagnose viral gastroenteritis. Doctors typically rely on a combination of factors to diagnose viral gastroenteritis, as its symptoms can overlap with other conditions. Clinical picture, symptoms and medical history. The doctor will assess common symptoms like nausea, vomiting, often sudden onset, watery diarrhea, usually non-bloody, abdominal cramps, low-grade fever, muscle aches, and fatigue. They will inquire about the onset and duration of symptoms, and if there's been any known exposure to others who are sick or recent travel history, epidemiology. Crucially, the absence of red flag symptoms is key. These include bloody or mucus-filled diarrhea, very high or prolonged fever, or severe, localized abdominal pain, which are more suggestive of bacterial or other serious conditions. Physical examination. The doctor will look for signs of dehydration and assess the abdomen for tenderness or other abnormalities. Exclusion diagnosis / watch and wait. For most mild to moderate cases, a presumptive diagnosis of viral gastroenteritis is made based on the classic clinical picture. Since most cases are self-limiting and there's no specific antiviral treatment, extensive testing isn't always necessary. Laboratory tests, when needed. If symptoms are severe, prolonged, worsening, or include red flags, tests may be ordered to rule out bacterial or parasitic infections, which are treatable with antibiotics or antiparasitics. Stool culture identifies bacterial pathogens. Stool PCR panels, newer molecular tests can quickly detect genetic material from multiple bacterial, viral, including norovirus and rotavirus, and parasitic pathogens. Parasite examination, ONP microscopic examination of stool for parasites. Blood tests may check for signs of severe infection, electrolyte imbalances, or kidney function. Beyond medical intervention, essential home care and supportive measures. While medical attention is critical for severe cases, much of the cure for viral gastroenteritis involves rigorous supportive care at home to help your body fight the virus and recover. Aggressive hydration with oral rehydration solutions, ORS. This is paramount to combat fluid and electrolyte loss from vomiting and diarrhea. Prioritize ORS. Products like Pedialyte or Cerolite are specifically formulated with the correct balance of salts and sugars for optimal fluid absorption. Sip slowly and frequently, avoid large gulps, which can trigger more vomiting. Avoid plain water alone, fruit juices, sodas, and caffeinated beverages, as their sugar content or diuretic effects can worsen dehydration. A note for parents: dehydration is a particularly serious risk for infants and young children. If your child is vomiting and cannot keep fluids down, is urinating less frequently than usual, or has a dry mouth, seek prompt medical attention. Ample rest. Your body needs energy to fight the virus. Avoid strenuous activities, work, or school. Allowing your body to direct its resources to recovery is crucial. Cautious use of over-the-counter symptom relievers, for adults/older children. These can offer comfort but do not cure the virus. Always use with caution and consult a doctor if unsure. Antidiarrheal medications, e.g., loperamide, bismuth subsalicylate, can slow diarrhea, but should be avoided in children unless advised by a doctor, and never used with bloody stools or high fever. Pain relievers/fever reducers like acetaminophen can help with aches and fever. Avoid NSAIDs, nonsteroidal anti-inflammatory drugs, like ibuprofen, Advil, or naproxen, Aleve, due to potential stomach irritation. Probiotics, as an adjunct. Certain probiotic strains may help restore gut flora balance and potentially shorten the duration of diarrhea. Discuss with a doctor or consider plain, bland probiotic-rich foods, like yogurt, once tolerated. Strict hygiene. While not a cure for your current illness, rigorous handwashing with soap and water, especially after using the bathroom and before eating, disinfecting contaminated surfaces, and avoiding sharing personal items are vital to prevent spreading the virus to others and to prevent reinfection. Strengthening your immune system, general health. While you can't supercharge your immune system to be invincible, you can significantly support its optimal functioning. Nutrient-rich diet. Emphasize a wide variety of fruits, vegetables, lean proteins, chicken, fish, eggs, legumes, whole grains, and healthy fats. Key nutrients for immunity include vitamins C, A, E, D, zinc, iron, and selenium. Probiotic-rich foods, yogurt, kimchi, also support gut health, where a significant portion of the immune system resides. Adequate sleep. Aim for 7 to 9 hours of quality sleep per night. Sleep deprivation suppresses immune function. Regular, moderate exercise boosts circulation of immune cells, improving their ability to detect pathogens. Stress management. Chronic stress can suppress the immune system. Practice mindfulness, meditation, yoga, or engage in hobbies. Healthy weight. Obesity can impair immune function. Limit harmful substances. Avoid smoking and excessive alcohol consumption. Stay hydrated. Water is essential for cellular function and maintaining mucous membrane integrity. Get vaccinated. Vaccines train your immune system to recognize and fight specific pathogens more effectively. Dietary considerations during recovery from a stomach virus. When recovering from a stomach virus, your digestive system is inflamed, sensitive, and working hard to heal. Given that there are no medications to directly kill these viruses, focusing on supportive care, particularly through careful dietary choices, is crucial. The primary goals are to prevent further irritation, minimize digestive effort, and ensure maximum safety from any additional pathogens, allowing your body to recover without added stress. For these reasons, it is strongly recommended that all foods consumed during recovery from a stomach virus be fully cooked and bland. This approach helps your compromised digestive system in several ways. Reduce digestive effort. Cooking breaks down tough fibers and complex proteins in foods, making them much softer and easier for a compromised digestive system to process. Raw foods, even those typically considered healthy, demand more digestive effort, which can exacerbate symptoms like cramping, bloating, and diarrhea. Maximized safety. Cooking provides an essential layer of safety by killing any potential pathogens that might be present in food, reducing the risk of reinfection or introducing new digestive challenges when your system is vulnerable. Preventing irritation. The heat from cooking can also break down compounds in some foods that might be irritating when raw. Blandness. Cooked foods are often consumed with fewer strong seasonings, which are also important to avoid during recovery. Recommended foods for recovery. After initial clear liquids and bland starches like the brat diet, bananas, rice, applesauce, and toast. Fully cooked, lean meats/proteins. Skinless, white meat chicken or turkey, baked, boiled, or grilled plain. White fish, cod, tilapia, haddock baked, broiled, or steamed. Eggs, scrambled, with minimal fat, boiled, or poached. Tofu, plain, soft, or silken tofu, baked or boiled. Very lean ground chicken or turkey, cooked thoroughly and drained, in small amounts. Thoroughly cooked vegetables. Boiled or steamed carrots. Cooked zucchini or squash, peeled. Plain, baked, or boiled potatoes, no skin, no butter/sour cream. Well-cooked green beans. Pureed vegetable soups can also be a good option. Fruits, very ripe, soft fruits like bananas are generally well tolerated. Other fruits might be better cooked into applesauce initially, due to their fiber content. These foods provide high-quality protein, zinc, iron, B vitamins, and selenium, which are crucial for the body's overall healing and energy, indirectly supporting the immune system during recovery. Foods to avoid during recovery. Raw foods, including raw vegetables/salads. The high insoluble fiber content and rough texture of raw vegetables can be highly irritating to an inflamed gut, potentially worsening diarrhea and abdominal cramping. Raw foods also carry a slightly higher risk of containing residual pathogens that you want to avoid when your immune system is already compromised. Red meat, beef, pork, lamb generally too heavy and fatty, and their dense protein structure can be difficult for a compromised digestive system. Undercooked meat of any kind, this includes rare steaks, runny egg yolks, unless pasteurized for safety, or any meat not cooked to proper internal temperatures. Never consume raw meat or poultry due to the high risk of severe bacterial, e.g., Salmonella, E. coli, Campylobacter, and parasitic infections, e.g., Trichinella, tapeworms, Toxoplasma. Processed meats, bacon, sausage, deli meats, etc., are often high in fat, sodium, and preservatives that can irritate the gut. Fried or highly seasoned foods can irritate the gut lining. Once the patient has fully recovered and is tolerating a normal range of cooked foods without discomfort, they can gradually reintroduce raw foods, starting with well-washed, easy-to-digest options, and monitoring their body's response. Heartburn/GERD and abdominal pain, no link to heart problems, but mimics pain. Heartburn is a burning sensation in the chest caused by acid reflux, stomach acid flowing back into the esophagus. GERD is the chronic form of acid reflux. While primarily a chest sensation, GERD can cause pain perceived in the upper abdomen due to proximity. The stomach is directly below the esophagus. Indigestion/dyspepsia, overlapping symptoms like bloating and upper abdominal discomfort are common with GERD. Stomach sensitivity, coexisting conditions like gastritis can make the stomach more sensitive to acid. Hiatal hernia, a condition where part of the stomach pushes up into the chest through the diaphragm, can cause upper abdominal pressure. Referred pain, nerve pathways can cause pain from the esophagus to be felt elsewhere. Crucially, heartburn has nothing to do with your heart in terms of its origin. It's a digestive issue. However, due to the anatomical proximity of the esophagus and heart, and shared nerve pathways, the pain of heartburn can mimic the symptoms of a heart attack or angina, chest pain or discomfort from reduced blood flow to the heart. Both can cause chest pressure or discomfort. When to seek immediate medical attention. If you experience new, severe, or persistent chest pain, especially if accompanied by shortness of breath, sweating, dizziness, nausea, or pain radiating to your arm, jaw, or back, seek emergency medical help immediately. It is always safer to assume it's a heart-related issue until proven otherwise by medical professionals. They have the tools, ECG or electrocardiogram, a test that checks your heart's electrical activity, and blood tests, to quickly differentiate between cardiac and non-cardiac causes of pain. Conclusion. Navigating the complexities of abdominal pain requires understanding the distinctions between general discomfort and specific, identifiable illnesses. While many stomach aches are minor issues, the presence of symptoms like vomiting and watery diarrhea often signals a viral gastroenteritis infection. Ultimately, the key to recovering from a stomach virus lies in the power of your own body. There are no medications to kill these viruses, so your immune system does the hard work. Your role is to provide it with the optimal environment for success. This means prioritizing aggressive hydration to prevent dehydration, ample rest to conserve energy, and supportive dietary choices, especially relying on bland, fully cooked foods to ease digestion and ensure safety. By understanding when to manage symptoms at home and when to seek medical care for complications, you can effectively navigate recovery and return to health.